health outcomes, changes due to interventions. To bring positive change, patient experiences and health must both improve. Healthcare costs must be lowered, and clinician and staff burnout has to end. But our problems are big. 133 million Americans have at least one chronic disease. 500,000 people are dying every year from hospital errors, injuries, and infection. The shortage of primary care professionals will be as much as 100,000 in just the next 5 years. Big problems require bigger solutions. Positive change needs acceleration. It needs to happen now. But these are not so easy solutions that many don't want to hear, and even fewer are willing to talk about. How to lead such a change? How to discover, discuss, and disrupt healthcare to make a difference now? This is VITALS, Visionary Health Leadership in Action.
Dr. John Langell is the president of Northeast Ohio Medical University. The public university is comprised of 4 colleges: the College of Medicine, the College of Pharmacy, the College of Graduate Studies, and the Batante College of Dentistry. A Lean Six Sigma Black Belt, Dr. Langell has more than 25 years of experience in higher education and has served in senior leadership positions in academic healthcare, industry and nonprofit organizations, and the federal government as a commander in the U.S. Air Force. With more than a dozen patent filings, 6 of which are licensed, 3 software copyrights, and 5 companies of which he has been a founding partner, Dr. Langell is a supporter of research, enterprise development, and innovation. Please welcome Dr. John Langell.
VITALS is about highlighting leaders in healthcare. Many of the leaders that you've seen present over the course of the last 3 years of VITALS have been clinicians, many times physicians and nurses. You may have asked where they got their leadership experience from. After decades of education, starting off with undergraduate programming, onto graduate school, oftentimes into residencies that may take them out 2 or sometimes 3 decades after a few years of practice, when did they have the time to learn the skills to be a great leader, to be able to implement the changes that you've heard about? Foundationally, it all starts with higher education. Higher education is critical to introducing leaders to the foundations of leadership skills, whether it's business, finance, negotiations, people management. These skills are critical to be able to be a great leader and to take the people under you, engage them into a passion that allows them to invoke change that we're trying to complete as part of the healthcare improvement process. So I'm going to focus a little bit on higher education. Higher education traditionally starts off with a bachelor's degree, but higher education is not something that's been available to the average member of the public for more than a century. In fact, it was reserved for those privileged and those with the economic status to be able to take time off and to undergo formal educational programming. Fortunately, in the United States, we have an emphasis on higher education, and our system of higher education now allows the masses to be able to access the critical information, the knowledge, the skills necessary to pursue their life's dreams. It's played a major role in the United States, especially after World War II, when there was a rapid expansion of colleges and universities to meet the demands of a growing public. Part of that escalation was because of the post-World War II GI Bill. Over time, the value of education has come into question. And in fact, we are in a crossroads right now in higher education. Students, parents, legislators, and the public are beginning to question what the value we offer through a degree process is today. The Pew Research Foundation completed a research study recently demonstrating that only 22% of Americans who were polled felt that higher education and the attainment of a bachelor's degree was worth doing if you had to take out any type of student loan whatsoever. 25% felt that it didn't really lead to higher salaries or better jobs by pursuing a bachelor's degree. Interestingly enough, 41% of students feel that higher education institutions don't care about them as individuals or take into account their needs or wants in their educational pursuits. Over 50% of parents thought there was a need for something else besides college and a bachelor's degree attainment, something easier, something less expensive, something that wasn't going to require the amount of debt necessary to pursue their educational goals. And at the same time, our legislators are very critical of the higher education institutions. They believe that our escalating costs are unwarranted. They believe that we suffer from an administrative bloat. And even on both sides of the aisle, they believe that we are a source of teaching ideology rather than a venue that teaches individual students to think critically and make their own decisions and determinations on thought processes. Value in higher education is very hard to measure, and it's true, costs have escalated. There are some Ivy Leagues that are now charging tuitions of $60,000+ per year, while most flagships and other public institutions have kept their costs lower. We have generally outpaced inflation. So how do you measure value? How do you determine the value in the education that you're getting to know whether it's going to take you to where you want to go? First, you need to start with what is it you want to do, because you can't measure those outcome metrics until you know what that is. And unfortunately, most college students don't actually know what it is they want to do, why they're going to college specifically, other than offering a better benefit to their life, gaining skills, improving their economic and social mobility. So how do I measure the impact of what I'm paying for? You can look at services and products through the SEC algorithm. So S is searchable, E is experiential, and C is credence. Searchable products and services, we can get on the internet, we can talk to others, we can look at databases and understand what the value of something is. If you buy an automobile, you can look at what the quality of the automobile is. You know what you're paying for. You know what the automobile does. And today's services allow us also to look at what the outcomes are. How often do they break down? What's the quality? What does the warranty look like? Something that's experiential is more like your travel. When you go on a vacation, you don't really know what it is you're getting completely until you've experienced it. Many of the services that we use on a day-to-day basis when you hire a contractor are experiential based. You know what you got as soon as it's been delivered. But credence products, on the other hand, you may never be able to measure the quality and the value that you've acquired. Healthcare, legal services, and higher education, some of our biggest and most important industries that affect our lives, tend to be credence-based industries. If I attend an Ivy League at $60,000 a year versus attending a public university at $15,000 a year, or a city college at substantially less, and I'm taking a Spanish course in each of those, how do I compare whether I learned more in one or I'm going to gain more insight, knowledge, and opportunities compared to each other relative to the price? Well, I don't. There's no standardized test that I take after college that demonstrates how much I learned relative to some outcome. We just assume that we're getting quality and value out of it. Some universities offer great value and quality, and others may not, but it's not really something we can compare. Fortunately, when you go into a profession like medicine, law, nursing, pharmacy, we do have standards. You take tests along the way. You take national standardized examinations. You might match into a residency, and you can look at all of those rates and actually be a well-informed consumer, taking it from a credence product to more of a searchable product. Not completely searchable, more experiential sometimes, because not every university wants you to see what their numbers are. So higher education needs to figure out how to transform itself. Enrollment has dropped by about 14% in undergraduates since 2010. We're expecting another cliff to occur by about 2030, where another 15% reduction in enrollment will occur. This means we have too many colleges and universities and questionable quality at many of those. So we're starting to see a reduction now. Since 2020, there have been over 60 colleges who've shut their doors in the United States, and experts are predicting that a total of 30% of all higher education institutions will be closing their doors within the next decade. Those of us who are in this business need to lead and to innovate to create high-value, high-quality programming. I want to share with you what we're doing at Northeast Ohio Medical University. We're a public university in the state of Ohio, and our focus is graduate health and sciences education. One could look at us as a credence product in some ways, but mostly a searchable and experiential product for most of our programs. We have 4 colleges: a new College of Dentistry, a College of Medicine, a College of Pharmacy, and a College of Graduate Studies. We've been innovative in our approaches over the past 5 years to operational excellence, which allows us to do more with the resources that we have, and educational excellence, which allows us to deliver high-value, high-quality programming to every student who walks onto this campus. Interestingly, higher education hasn't truly adopted operational excellence across most of our enterprise, but those skills to do so and the knowledge to do so exist in other industries. It's time to apply them to what we do. Lean Six Sigma, zero-based budgeting. These type of operational excellence programs empower our employees to deliver ultimately high-quality value to our customers. And our customers are pretty substantial. It's not just our students and their parents. As a public institution, it's the state taxpayers, it's the legislators, it's the local community that we serve. So we are very adamant about our approach to this being Lean Six Sigma, zero-based budgeting, do more with less, waste less, and apply your resources to what you're supposed to be delivering on. This has allowed this university to be in a really good position relative to the rest of the higher education market. And in fact, while the enrollment is declining nationwide and statewide, Northeast Ohio Medical University's enrollment has increased over 70% in the last 4 years when we include our new executive education program. Our benchmark measures of financial success, our reserves, our bond ratings, and our ability to reduce our deferred maintenance have all been exceptional, with bond rating increases in our total reserves to be able to support the growth and maintenance of our campus, and a reduction in our total deferred maintenance. But our real key is a focus on innovation in producing high-value education. Educational excellence is the reason we exist. And we do this in a number of ways, and I'm going to share just a few of those with you so that you can understand what it is we're doing and how we're doing it differently. We need to focus on creating high-value, high-reward programs for our students. Our students come here expecting to obtain skills to pursue a profession, and that the cost of that skill acquisition, their tuition, should yield a good return on investment for them. And at the same time, our programs should be serving the community that those students will eventually be serving. One of the ways we did this is through creation of a new certified anesthesiologist assistant program. Ohio was the innovator in this country in developing the very first CAA program in the nation. It is now available as a viable and successful profession in 18 states. NEOMED has created the second CAA program in the state of Ohio. Our graduates earn, in their first year out of school, they are able to earn twice what it is they'll be paying in tuition. And so the return on their investment long-term in their careers from a financial perspective is outstanding. Their skills allow them to work directly with patients, to take care of patients during their most vulnerable moments during surgery, working under the guidance and expertise of a certified anesthesiologist, a physician. That program has now been in operation for 3 years, and it is our most competitive program. We receive 200 applicants for every one position that we have available. We're doing the same thing now with mental health. The mental health crisis in the United States and in Ohio has become cataclysmic. Not just suicides, but also drug addiction and substance abuse. In Ohio, we have over 11 million people who are only served by 1,200 psychiatrists, and those numbers are expected to dwindle to about 800 by 2030. To be able to operate at the level that a psychiatrist does, or at least near that level, much like a nurse practitioner or a PA could do, we need a bigger workforce. Unfortunately, physician assistants and nurse practitioners tend not to go into the mental health workforce space. So we've been working with the legislature, both on the Senate and the House side, to create Senate Bill 60 and House Bill 97. This will allow us to be able to launch a certified mental health assistant program, very much like the CAA program, but this time a sequestered workforce who will be dedicated to taking care of patients' mental health and substance abuse needs. Now, this is a big pull. It's never been done before by any institution or in any state, which means we need to create the very first program in higher education, and we need recognition for state professional licensure. And both of those are underway, and we've been diligently working at this for 2 years, and it looks like we're finally going to get the progress we need in the state legislature and be able to open up our very first program. But innovation doesn't need to be about just creating new programs. It should be about innovating around the programs that we already have. Students have a right to expect that when they come to a university, they're getting a high quality and measurable education. That's a given. If you come here to go to medical school, for instance, we expect that your progression through the first, second, third, and fourth years should be high. In fact, it should be higher than the national benchmarks. You should be able to pass USMLE Step 1, Step 2, and eventually Step 3, and we should have a high match rate, 99 to 100% of our students matching into their residency of choice. That's a given. Our curriculum needs to get you there. Our educators need to be able to do that. But some students need more assistance and help than others do. Because of that, we've created the Center for Teaching Excellence and separately the Center for Learning Excellence, one focused on our students, on our educators, to focus on innovative pedagogy, or the science of how to teach and how to help students retain the learning that we are providing for them. We do this in some novel ways. At this university, we have adopted peer teaching. So peer-based teaching is a model that was first conceived at Harvard University in engineering, but there are only 4 medical schools in the nation doing it. Students learn in advance, are guided and facilitated by expert clinicians and basic scientists, and work together in a very high-tech room. That room allows the students to interact on their computers with 5 other students at the same time, while also being able to project and interact broadly across the entire classroom while being facilitated learning and teaching each other. We've also started a new College of Dentistry, which will innovate by taking the lessons learned from medicine and applying them to dental schools to be able to reduce the cost of tuition by half while increasing the experiential education of dental students to 3- or 4-fold what would normally be experienced within a College of Dentistry. So we've really taken the reins of leading innovation, improving healthcare outcomes, and creating transformational leaders. The one last example I'd like to provide you is our College of Medicine and our College of Pharmacy, and soon our College of Dentistry, will be able to enter into a transformational leadership program that has already started in medicine now. So students who will go through 4 years of medical school now have the ability to come in for an M0 year or a medical grade 0 year, in which they can either pursue understanding product development for new technologies in medicine, health system science and leadership to become the new leaders of the health systems that are supplying healthcare to our nation, global health programming, or to help those who've really demonstrated their capabilities from an academic standpoint, but are struggling somewhat through the National Standardized Testing Programming through our Masters in the Foundations of Medicine. So those are just a few of the many. While we are continuing to grow and to excel, our ultimate focus is on our students' educational outcomes and ensuring that they are getting the value for the education that they are coming here to be able to attain. Thank you very much. I look forward to hearing questions from the audience so that we can continue our dialogue and learn more as we interact with one another. Please welcome our moderator, Russ Mitchell, from Channel 3 News in Cleveland.
Dr. Langell, thank you so much for having me today. It was a fascinating presentation there, a lot of ground to unpack, and as you said, looking forward to questions from folks watching. Let me ask you the first question. Obviously, you spent a lot of time talking about the value of higher education and how it is being questioned these days. I ask you to amplify that just a bit. If you were sitting in a potential student's living room, how would you convince them to pursue higher education beyond a bachelor's degree?
Well, I think it's important that we not think about higher education as transactional. We've moved towards more of this transactional concept that I'm coming to the university or the college in order to pay for a class that's going to get me a career. Well, ultimately, that is an important aspect. Being able to support yourself and having the finances necessary to live your life is key, and that's something that college does for you, that a university does for you. But it's more than just transactional activities that take place. It's continued development of the whole person after they've graduated high school. And the courses that you learn from, whether they're in the humanities or they're in the sciences, are going to help make you a better person. Certainly, some courses may have more impact on you than others, but it's important to realize that this is continued growth and development, and it's not one that everybody is going to experience. Some people have decided early on that they want to be more in a tech-based field, and it may not fit them to go to a four-year college. Perhaps it's a two-year college, or perhaps it's just an opportunity to work under the tutelage of somebody in the particular field. It's tough because we have people make that decision at a very, very early age, typically 16, 17, 18 years old. But we're also fortunate, being in the United States, that you're not committed at that time. You can be a student who enters in at 25, 28, 35, or even 60 years of age when you've decided that you've missed something. There's more that you want from it. Many careers, many professions that students do want to pursue, their lifelong dreams, require significant amounts of education. And it is a little bit of delayed gratification. But to do that means going to a college, typically a bachelor's degree at the minimum, and sometimes moving on to postgraduate education. So if you want to be a doctor or a lawyer or a nurse practitioner or a certified anesthesia assistant, you know you have that pathway ahead of you. Your driver shouldn't be money. If that's the only reason you're doing it, you may not be a happy person later in life, but you should have an expectation for a good return on what you do for society, what your position is, and you would like to get a good return on investment for the cost of what that education was for you later on in life. So I think every person, every student needs to think and reflect, decide what's best for them. Realize that college is not just attending courses so that you can get a degree and check that box and move on. It's about continued social development. It's about continued knowledge acquisition. And it's about making you a critical thinker and a better and more well-informed citizen, at least here in the United States.
Doctor, you talked about credence. Can you please explain that concept a little?
Sure. So credence refers to a belief in that something is true without necessarily having any data that that thing you believe in is actually a fact. And that's part of this concept of a credence product. To get back just quickly to why it's not necessarily a searchable product means with a searchable product, I can look at that product, I can assess it in advance, I know what I'm getting, there's data that tells me here's what you're going to get. With a searchable product, it's pretty easy to make a decision. You're going to pay X, you're going to get Y. With an experiential product, or service, it's a little bit different. It's going to change. I mentioned travel. Your travel is an experience broadly, and if you signed up for a trip to Europe to go out bicycling in Italy, it sounds really good, and you're going to hear about the bicycling trip, but you can't predict what the weather's going to be like, what traffic delays are going to be like, whether your flight's going to be canceled and you're going to spend an extra day in New York trying to get there. So your exact experience is going to be different than everyone else's, and you may come out of it unhappy or thinking it was okay, I wouldn't do it again, or you may be fortunate and everything comes together and your experience was wonderful. So you know what you got once it's over, once it's been delivered. But a credence product is different. And I'm not here to pick on Ivies. I think Ivy League colleges are wonderful. They do great things, and the perceived value is often greater perhaps than what you've actually received, because people look at it and say, you've gone to X and that's a great place, therefore you must be a great person. And that is something that you need to put in your value equation. Does it get you somewhere simply because of the name and the brand through which you acquired your education? But I mentioned taking a class. If you take a course in history at an Ivy League versus a public flagship versus a public university that's not a flagship, or a private college or a community college, there's really no way for you to compare them to each other. You can say it costs this much money for me to attend that course, and my opportunity cost was something else relative to what I could have been doing, but I can't compare the quality and the knowledge acquisition I received from any of those different groups. I just assume it's there. We assume that because you're paying $60,000 a year to go to an Ivy, that you got a better education than the person who spent $3,000 to go to community college. But in fact, that may not be true. It really comes down to the interaction between you, the student, and the faculty member. And sometimes you may be at an institution who's got a world-renowned faculty member in their field who really doesn't do that much of the teaching. It's really done by the graduate students. So what is it that you're getting? And going to college and getting a degree versus somebody who didn't, where are you going to end up in life? Are you going to be happier? Are you going to receive different wages? You assume that's going to be true, but there's no way to validate that. So credence products are tough. You have to believe in what you're getting. So I tell students, I think the most important thing for you is to focus on, where do you think you're going to be happiest? What's the best fit for you? Which campus personality and other students who are there look like they're going to be reflective of an organization and a society that you want to be with for at least 4 years, and for many of us, 12 plus years.
Gaps in the workforce right now, and where does medical education fit in?
Well, 17% of our GDP, I know that number's been thrown around a lot, that's a huge number, is spent on healthcare. That translates into about 11% of all jobs in the United States. And those jobs are critical for taking care of our citizens, people during periods of sickness or maintaining their health. And we have huge gaps. Those gaps are all along the entire continuum, from laboratory technicians to pharmacy technicians to nurses, nurse practitioners, physicians. And those gaps have great impact on our ability to acquire healthcare and for us to have quality lives as individuals within the United States. Those gaps need to be filled. It's job security when you go into a health and sciences field. And although I emphasize again, it's really about pursuing a profession that you're satisfied with, that you really enjoy practicing in. Your return on investment tends to be very high in healthcare and in the health practice fields. Right now, if you look at what are the top 25 best paying jobs in the United States, you'll find that 22 of those are in the health care delivery fields, whether it's a nurse practitioner, a cardiologist, an orthopedic surgeon. Those are the fields that are paying really well. So your return on investment from those pursuits tends to be very high. You have a job that's satisfying because you're helping other people. That if that's not what you want to do, you should not be in the health and sciences. It's not about the money, and it is delayed gratification, but the gaps are very, very large. We need more people, and the public needs more people to care for them.
I'm assuming the pandemic made that need even stronger.
It did. There's a number of reports regarding the workforce shortages in healthcare due to the pandemic. Many of those are estimating that we've lost about 20% of our healthcare workforce. Part of that is because we had people getting close to retirement who were continuing to work, and the challenges associated with running a practice. For instance, dentists tend to be in private practice. They were paying the bills on running an enterprise where they weren't having patients coming in. It became a loss, so it was time to step away. For many, for instance, in the nursing field, it was a very difficult time. You were on the front lines. In the early days, we weren't sure whether this was going to wipe out half the population or it was going to be something that just kind of breezed by. It tended to be somewhere in the middle, but people came in scared. People came in demanding. Nurses and other healthcare providers often were treated differently, less respect, because people were nervous and concerned and wanted the help they needed to get. There's been an escalation of violence in healthcare facilities, physical attacks against especially nurses and sometimes physicians. And this quality of life and this quality of profession that they had before went away. And so many people have left the workforce because of it.
I have some questions from the audience for you. This first question is, are most NEOMED graduates practicing medicine in Ohio for the most part?
Yeah, so we track that because we're a public institution and it's part of our job. That's the reason the state stood us up, is to help with workforce development, especially in the health and sciences here in Ohio. So we take about 75 to 80% in-state residents into our classes. Many of them become Ohio residents. So if you look at our snapshot, we're about 90% with our students. And in general, we end up with about 60% of our physicians who will stay long-term and practice and serve the communities in Ohio. It's a much higher number for our pharmacy graduates. They tend to be closer to 85 to 90% practicing within the state to serve the communities here. But we are also somewhat subsidized from the state of Ohio, and that's expected from us. So part of our job in recruiting is to make sure that we're going to retain a workforce to serve the taxpayers.
Another question from the audience here. Do you have to have a bachelor's degree to pursue a pharmacy degree at your university?
So interestingly, you don't. You can go through a pathway of meeting the basic criteria to get into a Doctor of Pharmacy program, although most of them do complete at least an AA degree as well as the required basic courses. We have pathway programs with our community colleges that'll allow students who've decided to use community college pathways, which are less expensive and oftentimes more accommodating, especially to a working student who may need more evening or weekend classes, to still be able to fulfill that desire of theirs to get into pharmacy and get a doctorate degree. And it's a pretty fair number of our students who will go through those pathways.
Another question from the audience here. Who is a good candidate for the anesthesiologist?
So the anesthesiologist assistant program is typically a candidate who's gone through the same level of basic university bachelor degree training that a student applying to the College of Medicine would have as part of their background. But not everybody wants to go through 4 years of bachelor's degree. Typically in the US, the average is closer to 6 years, which is why we measure success metrics at 6 and 8 years for undergraduate institutions. So say you do 6, you come into medical school and you do another 4, and then you go into residency and you're going to do anywhere between 3 and as many as 10, depending on what your specialty of practice is. For these students who want to deliver healthcare almost at the level of an anesthesiologist, but certainly with anesthesiology oversight, on the ground, taking care of patients, delivering anesthesia side by side with our anesthesiologist, it's a really good choice. It's 2 years, there's no residency, you're right out into practice. And for those who are, as most people would be, looking at what's your return on investment, some of the starting positions for a CAA right now are $160,000 to $250,000 a year. So the return on investment financially, as well as from an opportunity cost and how long it takes to get out and practice, are substantially shorter. So it's really about balancing what that particular student wants. What are you going to be content with? What are you going to be passionate? What are you passionate about?
Another viewer is asking, where are your graduates doing their clinical work? What about their residencies?
Our residencies, that's part of the match process. And we typically have residencies for 2 different categories. One is our pharmacy students. Many of them will elect to do a residency program, typically 1, sometimes 2 years. And then our medical graduates, all of whom do a residency, or at least they're expected to as part of what's necessary to be able to practice. And they go all over the place. We have students matching from California to New York, from Sutter hospitals to Harvard, Mass General, but the majority of them stay right here in the state of Ohio, and they're getting outstanding, high-quality academic residencies if that's what they're electing to do in places like university hospitals, Akron Children's Hospital, Cleveland Clinic, Ohio State University, University of Cincinnati. So they are at least as competitive, if not more competitive, than many other medical schools. But meeting our mission, most of them are staying right here in the state.
I'm going to go back to the question I posed to you earlier from a viewer. A follow-up to that. This is regarding the bachelor to pursue a pharmacy degree at university. You said it, interestingly enough, do not have a bachelor. Are there any other positions in the medical field that you don't have to have a bachelor's degree to pursue as we move forward?
There are laboratory medical technicians for one, pharmacy technicians is another one. Some of the nursing programs, so if you have a BSN, that allows you to operate at a particular level, but an LVN is not a 4-year degree. So there are a number of different pathways that students can pursue, and many of those are directly out of a community college, which tends to be right in the neighborhood where the student is living and working, and it gives them the opportunity to accelerate through that process. Others require a 4-year degree, and many of the more senior level positions or positions like being a physician, obviously much longer time frame for training.
Another viewer wants to know about the dental. What can you tell us about?
Yeah, so we've been going through the process of creating a new College of Dentistry. It's the Vitante College of Dentistry. The name was received by a very generous family that has donated to help get this this college launched. It's a 3-year process to get through the CODA accreditation. That's the Council on Dental Accreditation. We are almost there. We will hear whether we're accredited by August of this year, and we expect that we'll receive that designation. Everything has gone very well in our process, and we'll be recruiting our very first students who will start in about August of 2025. Traditionally, dental schools have started up really large practices on their campuses and offered low cost or free care. And that's a way to get patients in and the students work on them and get their experiences that way. They're very costly to run. They typically, at most institutions, are not focused on the ensuring a business model that's giving enough of a return for it to run independently, so it's pretty subsidized. We've decided to take a different approach, and one that shouldn't be as novel as it is, but it's relatively innovative in the field of dental education, is to try and broadly take our students like we do in medicine and pair them up at academic training sites that do dental residencies, so that the dental students will work side by side academic clinicians who tend to do more work caring for the underserved and those in the Medicaid populations, and doing so with residents who've completed dental school and are now operating as trainees but are fully licensed dentists at the same time. This means they're going to get exposed to more procedures. We hope it's also going to increase the level and quality of teaching and the experience for those students to get out into the different communities that we would like them to eventually serve when they graduate. As we've modeled this out, we will be offering a tuition that's about half the tuition cost of many other dental colleges in the country. So we're pretty excited about this and have a big focus on social determinants of health for our dental students, just like we do in medicine, so that you better understand how an individual's background, whether it's their race, their ethnicity, their socioeconomic status, affects their ability to access healthcare and promote a broader participation of our graduates to take care of populations that are oftentimes neglected right now.
Another question from the audience. Do you have a student clinic? A clinic run by your students, and what other opportunities are there for students to get involved in the community?
So our student-run free clinic has been ranked #1 at least twice in the last few years by the state of Ohio. It is designated as a gold clinic. It opens its doors to any comers. We expect that it's mostly for uninsured and underinsured, but we ask, but we don't investigate and check. Students come together in interdisciplinary teams, take leadership roles. There are 30 leadership roles currently, in fact, across our different colleges, and it's interdisciplinary. So we'll have pharmacy students at different levels, medical students at different levels, PA students from other institutions, so physician assistants, and sometimes nursing students, and we've had sociology students from other universities. They come together to deliver a holistic care to the patients. They are not time constrained, and our patients tend to be those most in need. Now, this is run appropriately under the guidance of licensed clinicians in the state of Ohio, and it's been a really outstanding opportunity to serve our community, doing both primary care, a little bit of not OB, but gynecologic care. We do laboratory services, and we also do behavioral health care. We have over 100 student groups at this university, and every one of them has a requirement for community service. So each of them participates in their own way in serving our community, typically in the health and the sciences area. One unique training opportunity that we have is our College of Pharmacy started up Neovations LLC, which is a pharmacy consulting service. It does MTM, or medication therapy management. These are one of the scorecards that CMS gives institutions, and they do televisits and do medication reconciliation and optimization with patients who've been discharged from hospitals, for instance. And it's a great experience for them to actually be active, to work with the community. And this program it's quite amazing. There's a national organization called Outcomes that ranks different MTMs. And because of our size, we're ranked as a hospital system or a health system. And this year, a student-led with adult oversight organization was ranked the #1 MTM in the nation. So pretty amazing outcomes that these students are having, and at the same time, wonderful experiences that they're getting in practice.
The question from the audience: you have a post-baccalaureate program. I guess that's a post-bac in your world. This person says, I don't see it on the website.
We do have a post-bac program. Well, we've got multiple programs that could be considered post-bac, but the one post-bac program that we created was to increase the school's student diversity to be reflective of the state of Ohio. That program takes students who've done well. They've completed their college degrees. They have had some challenges perhaps on something like the MCAT exam, which is an entrance exam you take to get into medical school. It's well known that the standardized exams are biased, right? We can see different outcomes in different populations. So we decided to overcome those biases by allowing students to come into a program that may not have quite hit the mark on an MCAT score, for instance, but it looked like a really qualified student, typically from Ohio. And those students will come in and take a couple of the most difficult courses in our first year of medicine while getting other educational programming towards a master's degree in 1 year. And if they can show that they have the capabilities to get through, we'll offer them a spot as an M1. So this is kind of like what we call an M0 year, but an M1 in medical student first year. We've been incredibly successful in this program. Some years 100% matriculate directly over, but in general, over 95% of our students move on into med school. They've shown that they have what it takes. The MCAT really wasn't the important predictor for them. And I know we've had at least one, if not a few, who've decided that this opportunity has opened the door for them to go someplace else if they perhaps were an out-of-state student. Our other programs are really about innovation and leadership, and those are our 5-year MS, MD pathways, so that it's an expectation that you come out as a great clinician. But if you want to be a medical device innovator and a physician, or you want to be a health systems leader, or you want to be a global health expert, you can come in and do your first year with us and then move directly on into your medical school years so that you're getting this specialty training early on to make you think differently and start to pursue your goals early on. Typically, we take 40 to 50 now in our medical school class who will go through these pathways. It's a part of our transformational leaders program. We always want to create great clinicians, but there's a great number of leaders that come out of this institution, and now we're purposely trying to give them their launch through this type of programming.
Langell, I've enjoyed our conversation today. Any final thoughts?
The talk can sometimes leave people wondering, why is higher education in such a bad place? And we're not really. We just need to be better at how we run our operations and ensure we're delivering quality and be innovative. I would tell anyone out there who's a potential student that higher education is a wonderful place to be. It's about more knowledge acquisition. It is a launching point for you for your careers. More college graduates are content with their lifestyle and their job than non-college graduates. From a financial standpoint, for somebody who just decides to go into the workforce at a high school versus a bachelor's degree, there's about a $30,000 a year earnings difference that occurs. So it is a highly valuable opportunity. Wonderful people as faculty who want to teach, who are passionate about making you better people and better citizens. Everybody who's here is here because they want those students to do well and succeed in life. So I think it's a great time in higher education for us to redefine who we are and to be really outstanding at what we do. I want to thank you, Russ, for your expert moderation, and thank the audience for their attendance today. I hope what we talked about together is a nidus for you to go out and implement change, or for a student to rethink decisions that they may have made in the past about not wanting to move on to higher education. Thank you.
Thank you.
This is VITALS, Visionary Health Leadership in Action.